Severe acute respiratory syndrome, coronavirus, is not a new disease. It already raised a serious outbreak in 2003 and 2004. This video describes about the previous outbreak of severe acute respiratory syndrome 2003 and 2004. All the information shown in this video is collected from various trusted sources. Source links of trusted websites is mentioned in the description below.
Global Severe Acute Respiratory Syndrome, coronavirus, outbreak in 2003. According to the World Health Organization, between November 2002 and July 2003, a total of 8,098 people worldwide became sick with severe acute respiratory syndrome that was accompanied by either pneumonia or respiratory distress syndrome. Probable cases. Of these, 774 died. By late July 2003, no new cases were being reported, and World Health Organization declared the global outbreak to be over. Severe acute respiratory syndrome, coronavirus, outbreak in 2004. In April 2004, the Chinese Ministry of Health reported several new cases of possible SARS in Beijing and in Anhui Province, which is located in east-central China. As of April 26, 2004, the Ministry of Health had reported 8 possible SARS cases. 6 in Beijing and 2 in Anhui Province. One of the patients in Anhui Province died. Nearly 1,000 contacts of these patients with possible SARS were kept under medical observation. At the request of the Chinese Ministry of Health, World Health Organization sent few members of an international team to help investigate the source of SARS cases reported in Beijing and the eastern province of Anhui in April 2004. The team which was sent for investigation included experts in epidemiology, virology, infection control, and laboratory biosafety. Results of investigations stated that laboratory research at the National Institute of Virology in Beijing was the likely source of the outbreak. The institute has been engaged in research with the SARS coronavirus, including the development of a vaccine. 2 of the reported cases were conducting research at the laboratory, a 26-year-old female postgraduate student from Anhui Province, and a 31-year-old man. The dates of symptom onset in the 2 cases are widely separated, 23 days, suggesting that more than one opportunity for exposure may have occurred in the laboratory from mid-March through early April. Authorities closed the Virology Institute and placed its more than 200 employees under medical observation. Numerous environmental samples from the laboratory have been taken to help assess possible sources of contamination. Global Severe Acute Respiratory Syndrome, coronavirus, outbreak, 2019. Dr. Li was working at the center of the outbreak in December when he noticed 7 cases of a virus that he thought looked like SARS, the virus that led to a global epidemic in 2003. The cases were thought to come from the Huanan seafood market in Wuhan, and the patients were in quarantine in his hospital. On December 30 he sent a message to fellow doctors in a chat group warning them about the outbreak and advising they wear protective clothing to avoid infection. 4 days later he was summoned to the Public Security Bureau, where he was told to sign a letter. In the letter he was accused of making false comments that had severely disturbed the social order. On December 31, 2019, China alerted World Health Organization to several cases of unusual pneumonia in Wuhan, a port city of 11 million people in the central Hubei province. The virus was unknown. Several of those infected worked at the city's Huanan seafood wholesale market, which was shut down on January 1, 2020. On January 5, 2020, Chinese officials ruled out the possibility that this was a recurrence of the severe acute respiratory syndrome, SARS, virus, an illness that originated in China and killed more than 770 people worldwide in 2002 to 2003. It was 10 days later, on January 20, 2020, that China declared the outbreak an emergency. Yet it was too late to declare emergency. Disease was spreaded to various countries and World Health Organization declared coronavirus as public health emergency of international concern on January 30, 2020. As on March 29, 2020, patients infected with coronavirus cases were 6,69,400 people and 32,155 deaths worldwide.